Video, Iona Heath. She's a retired general practitioner from Kentish Town in London.
I'm Iona Heath. I worked as a primary care physician in a deprived part of North London for almost 35 years. And from 2009 to 2012, I was president of the Royal College of General Practitioners in the UK. I'm 71 years old, and I was grateful to have been double vaccinated against COVID-19. I have 4 grandchildren, aged between 10 and 14. Every working day in primary care, I have seen how the theories of medicine work themselves out in the lives of individuals and families. And this experience has reminded me repeatedly of the provisional nature of knowledge. As time goes by, theories, knowledge, and certainty all come and go. A new drug that is greeted as a miracle is condemned as a poison a few months or years later. None of us can be certain about what the future will bring. I have long thought that one of the most important roles of a primary care physician is to protect patients from the harms of medicine. Because we are committed to seeing and hearing each person in the fullness of their context and biography, and we know that the body is not a machine. And because we work at the front line of medicine, at the point where science and life experience intersect. Medicine becomes dangerous whenever the lives, contexts, hopes, and priorities of individual patients are lost from view. Whenever healthcare becomes depersonalized by public health utilitarianism on the macro scale and/or by biomedical science on the micro scale. Many of the people we have heard from today have been squeezed between both these modes of depersonalization. Their individuality has been lost from view and their experience has been discounted. Listening to their stories, I have been powerfully reminded of a paper written by David Sackett 20 years ago, which had a very striking title, The Arrogance of Preventive Medicine. In it, he wrote, "Preventive medicine displays all 3 elements of arrogance. First, it is aggressively assertive, pursuing symptomless individuals and telling them what they must do to remain healthy. Occasionally invoking force of law, immunization, seatbelts, it prescribes and proscribes for both individual patients and the general citizenry of every age and stage. Second, preventive medicine is presumptuous, confident that the interventions it espouses will, on average, do more good than harm to those who accept and adhere to them. Finally, preventive medicine is overbearing, attacking those who question the value of its recommendations." End of quote. I'm confident that you can see why I thought of this paper by someone who has been described as the father of evidence-based medicine. Extraordinary things seem to happen to people in power, and and they begin to believe that fear can only be contained by absolute certainty, very much along the lines of, accept this wonder vaccine, it will stop you dying and it will do you no harm, or only harm of the most trivial nature. But people are not stupid. They know full well that life and death are full of uncertainty, and they also know that fear is contained not by certainty, but by trust. It is a tragedy for all of us that the devastations of the current pandemic have come just at the time when the extent of corruption within the medical industrial complex by powerful vested and financial interests has become undeniable and has made trust very hard to come by. All those who have suffered harm from vaccines, all the children for whom the risks seem to outweigh benefit, and all those whose livelihood and social interconnectedness are threatened by vaccine mandates are being asked to pay too high a price for the false certainty of those who think that they can predict the future. When British playwright Harold Pinter won the Nobel Prize for Literature in 2005, he said this, quote, "I believe that despite the enormous odds which exist, unflinching, unswerving, fierce intellectual determination as citizens to define the real truth of our lives and our societies is a crucial obligation which devolves upon us all. I think that this is what we have been trying to do today, and I thank you all.
I gave Dr. Heath a little short shrift here.